Are you wondering how long it takes for your rheumatoid arthritis medication to start working? Whether you're newly diagnosed or switching treatments, the waiting game can be frustrating. Let's break it down so you know exactly what to expect. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Let's get into today's topic. Rheumatoid arthritis, or RA, is a chronic autoimmune disease that causes inflammation, pain, and joint damage. The right medication can slow disease progression and even put it into remission, reducing pain and improving your overall quality of life. But one of the biggest concerns patients have is, when will I start feeling better? The answer depends on the type of medication that you're taking. Some drugs work quickly, while others take weeks or even months to show full results. RA is a condition where your immune system is overly active, and instead of just protecting your body from bacteria and viruses, it is actually actively attacking your own joints. Getting your immune system to stop doing this takes some time. It's like trying to turn a very large boat around. Imagine a massive cruise ship is heading in one direction. To turn it around and head in the opposite direction takes some time. First, the boat has to slow down, then it slowly starts to turn around until finally it is moving in the opposite direction. In the same way, modulating your immune system that is full on running in one direction takes some time to put it back into a healthy track. Let's go through the different types of RA medications, their expected timelines, and what you can do in the meantime to manage your symptoms. First off, there are fast-acting medications. These kick in within a few hours to a few days. These are used for quick symptom relief, but do not stop long-term disease progression. First off, there are non-steroidal anti-inflammatory drugs, or NSAIDs. They work within a few hours to a few days. Examples include ibuprofen, Advil, naproxen, Aleve, and Celebrex. They help to reduce pain and swelling, but they do not slow down the long-term RA outcome. And in fact, they do have other potential side effects if used too often long-term, including stomach ulcers, kidney and liver damage, and sometimes possibly even heart disease. Next, you've got corticosteroids. These include prednisone and other steroids. They have rapid relief within 24 to 48 hours. Again, they're used for short-term symptom control during RA flare-ups. They're not a long-term solution due to side effects like weight gain, high blood pressure, high blood sugar, and bone loss. It's important to note that while NSAIDs and steroids provide rapid relief, they don't address the root cause of RA long-term, namely an overactive immune system inflammation. Next, you've got disease-modifying anti-rheumatic drugs, or DMARDs. They are slower acting, but more effective and safer to use long-term than NSAIDs and steroids. DMARDs reduce long-term joint damage by controlling the immune system longer term. First off, there are traditional DMARDs. These include methotrexate, hydroxychloroquine, sulfasalazine, and leflunomide. These take 6 to 12 weeks to start working. Their full effect can be experienced within 3 to 6 months. Methotrexate is the most commonly used first-line RA medication. This medication and other DMARDs, they slow disease progression and prevent long-term joint damage. They can be combined with other DMARDs or biologics for better results. Very key tip, if you don't feel improvement after 3 months, talk to your doctor about dosage adjustments or combination therapy. The reason why we utilize DMARDs instead of NSAIDs and steroids long-term is because DMARDs are more effective long-term and safer to take long-term. They just take a bit longer to kick in. Next, you've got biologic medications. These are targeted and even more effective, stronger than traditional DMARDs in terms of controlling RA. But they still take some time to fully work. Biologics target specific parts of the immune system to reduce inflammation. First off, you have tumor necrosis factor, or TNF inhibitors. These will kick in 2 to 6 weeks to start working, full effects to be achieved in 3 to 6 months. Examples include Humira, Enbrel, Infliximab or Remicade, Cimzia, and Simponi. These are great for patients who don't respond well to methotrexate or other traditional DMARDs. Then you've got other biologics. These include interleukin and B-cell inhibitors. These will kick in 4 to 8 weeks with full benefits again in 3 to 6 months. Some examples include Actemra, Rituxan, and Orencia. Key takeaways here are that biologics work faster than traditional DMARDs, are stronger than traditional DMARDs, but they still do require some patience to get their max effectiveness. Next, you've got JAK inhibitors. These are newer, faster options for RA. JAK inhibitors block immune signals that cause inflammation. These will kick in 2 to 4 weeks with full effects in 2 to 3 months. Examples include Xeljanz, Oluminant, and Rinvoq. They work faster than traditional DMARDs and are taken as a pill, not as an injection. While you wait for your RA medication to kick in, here are some ways to manage your symptoms. First off, you want to stay active with gentle exercise. Walking, swimming, or yoga can help to reduce stiffness. Number 2, you want to follow an anti-inflammatory diet, eating more fruits, vegetables, fish, and nuts. Avoid processed foods and excess sugar. Number 3, use heat and cold therapy for pain relief. Heat pads relax the muscles, and ice packs will reduce swelling. Number 4 is consider supplements like omega-3, turmeric, and vitamin D, which may help lower inflammation as well. And number 5, work with your rheumatologist. If you're not seeing progress after 3 months of a medication, your doctor may adjust your treatment plan. Overall, some key takeaways here. The fast-acting medications, NSAIDs, and steroids help with pain, in particular RA flare-ups, but don't stop disease progression long-term and have some safety issues long-term as well. Traditional DMARDs, such as methotrexate, can take 6 to 12 weeks to start working. Biologics and JAK inhibitors work faster, but still require some patience. Support your treatment with diet, exercise, and other healthy habits. And of course, as always, work closely with your rheumatologist to adjust your medications if needed. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on managing RA and living pain-free. And until next time, as always, stay healthy and live well.